In part one, I showed you the scoring engine, how your claim gets converted into codes, and how the law changes depending on which side of the river you happen to be standing on. Now, the clinical half. This is where cases are actually won and lost. And it starts with a doctrine most people have heard of and almost nobody applies correctly. Somebody tosses a quarter off a roof. It hits a stranger on the sidewalk. Ordinarily, that is a few $100s and an apology. Now say that stranger has had skull surgery and there is bone missing. The man who threw the quarter did not know. It does not matter. You take your victim as you find them. That is the eggshell doctrine, and it is old law. What is new is that the doctrine has migrated from bone to mind. In our own patient population, and I am telling you what we see, not quoting a study, roughly 6 in 10 of the injured people who reach us are already carrying post-traumatic stress before the collision that brought them in. The crash does not create it, the crash detonates it. And a complex PTSD that keeps somebody off the highway keeps them out of work permanently. It migrates one more step into metabolism. My clinical position, stated as mine, is that you do not develop chronic pain in a body that was metabolically intact. And about 1 in 8 American adults is metabolically healthy, 12.2%. So when the defense says your client had a pre-existing condition, my answer is yes. Almost everybody does. That is the eggshell. It is not a discount. It is the reason the injury was worse. Counselor, this next part costs you cases, and you will never see it in a demand letter. Some of the strongest objective evidence in a head injury case is chemical, and it is disappearing while you wait on the police report. 2 blood biomarkers. UCHL1 peaks around 8 hours and falls away across 48. GFAP peaks around 20 hours, declines over 72, and can still be read out to about 7 days. In the ALERT-TBI study, that pairing predicted the absence of intracranial injury on CT with a sensitivity of 0.976 and a negative predictive value of 0.996. Read it the other direction, which is the direction that matters to you. A normal CT scan is not an all clear, and it gets handed to your client as one every day. And you do not have to strike your head to injure your brain. Acceleration and deceleration are sufficient. The absence of a bruise is not the absence of a lesion. That window is measured in hours. Your client's case is measured in years. Only one of those clocks is running out. To the injured person watching this part is yours. You are not imagining the rest of it. The sleep that does not restore you, the marriage gone thin, the friend you stopped calling, the account that is emptying. Social isolation is associated with a 29% increase in mortality risk. Loneliness, 26. Living alone, 32. The authors concluded that risk exceeds obesity. Isolation is not a mood, it is a clinical finding. And debt is a physiological event. Sustained financial fear keeps cortisol high, and high cortisol is catabolic. It instructs your body to break tissue down instead of rebuilding it. So understand what delay actually is. It is not disorganization. Drawing the process out while your bills stack up produces the exact biology that makes you heal slower, and then the slow healing gets used against you. And it does not end when treatment does. A Canadian study in JAMA surgery followed 18,050 patients for 3 years after brain injury. Income losses persisted into years 2 and 3, and were substantial even after mild injuries. Counselor, here's a liability I will take off your desk. There is a version of this business where the injured patient is managed on escalating narcotics for 18 months. And by the time you reach a deposition, opposing counsel is not trying your case anymore. They are trying your client's medication list. We do not do that. We are interventional first, and we do not run medication-only management. Our own numbers from our own population. 21% of patients under active interventional treatment are completely off opioid pain medication within 90 days. 34% within 1 year. Across our established patients, fewer than 1% remain above 90 morphine milligram equivalents a day, and most who cannot come off entirely are held below 30. Those are practice-reported figures, not trial outcomes, and individual results vary. But the point stands, a patient who is getting better is a better witness than a patient who is getting comfortable. So what is Injury Experts? It is urgent care, injury assessment, a concussion center, PTSD care, physical therapy, interventional pain management, and metabolic medicine under one roof, on one chart, in one documented course of care. Not because integration is a nice word, because the scoring engine punishes gaps. Every handoff to an outside practice is a hole in the timeline, and the software reads a hole as an absence of injury. For the attorney, that means one record, where the patient is in treatment, what has been done, what it has cost, what remains, expected completion, whether they have reached maximum medical improvement. Your paralegal stops chasing 11 fax numbers. One point of candor about our own technology, because I have described it badly before. We run a system called IntelliRx that screens prescribing risk, including publicly available information with patient consent and disclosure. Previously framed that as an intelligence advantage over the other side. That framing was wrong, and I am not repeating it. It is a safety tool so that we do not put controlled substances where they will do harm. Yes, a diverting patient destroys a legitimate case, and I would rather find that in week 1 than have you find it in a deposition. To the person who is hurt, you are not a claim number, your pain is not a rounding error in somebody's combined ratio, and the fact that a machine cannot see your injury is a statement about the machine. To the attorney, the record is the case. Everything else is argument. Bring us the patient before the insurer finishes defining them, and we will build you something a black box cannot discount. 25 years in this environment. We know the players, we know how it works, and we know exactly where it breaks. Come see us.